do 3 breaths and then you're gonna hold your breath, and when I remove it, I'll let you know when you can breathe again, okay? So we'll start now. Deep breath in, blow out. That's 1. Deep breath in, blow out. That's 2. And on this next one, hold. Deep breath in, hold. I'm gonna pull. It's gonna be a lot of pain and pressure, and you can breathe. A lot of pressure. And just try to breathe normally. Just tying the suture off, and the suture does not absorb. It's one we'll have to take out. So we take it out in clinic follow up. These sutures usually have to stay in for 2 to 4 weeks because that skin's a lot thicker.
All right, so do I have any drains hooked up to the lung at all now?
This one tracks through and goes up next to that conduit. So you do have this drain, but be careful because it's got a lot of laxity. So getting up and down can be a little daunting. We don't want it to get pulled out.
Yeah, I got you. Okay.
They get stuck in the chair, on doorknobs, or edges, so just be mindful.
Recording?
Yeah.
All right, so day 2. What time is it, baby?
11.
Like 11:01. They've got the lung drain tube out, and they've disconnected me from the oxygen. So I'm going to take there's a couple of laps around. I find it's better for me to talk and walk than to do the breathing treatment. I'm still doing the breathing treatment exercises, but this is another good thing that helps me to get my lungs clear. So my wife is holding the camera. She's here with my son, keeping me company today. And thank you. I'm just gonna make a couple of laps and be sure to respect everybody's privacy.
Okay, of course.
So I've got the Christmas decorations on it. As if they're starting to decorate here for Christmas. So now that they've got my pain medication straightened out a lot more, I'm not hurting nearly as bad. The pain part of it is a lot less now than it was before.
Okay, I gotta stop because there's people here.
That's fine. So I just want to try to respect everybody's privacy, or I don't want to be able to feel it, so, okay.
Okay.
I always try to be respectful of others, but it really feels good to walk, because when I walk, it's not only the walking and breathing and clearing out my lungs, but it stretches out my muscles. Being so confined really exacerbates the pain. So being able to walk around makes a big difference. Go down this hallway right here. Just do a couple of little laps. I hooked up the monitor so I can still monitor my oxygen levels, especially being on morphine. I want to make sure that you're not having any type of respiratory failure. So, in addition to walking and talking, the morphine has a tendency to limit your breathing. So all these things you have to keep in mind. So just take it easy. You can go really slow, or you can pick up your pace. Just be mindful of how you're feeling at the time. You start to feel dizzy. Don't push yourself too much. But you want to make sure that you're staying active as much as you can. Of course, there's lots of different factors you know, with what you're capable of. But just have to do what you can do.
Look at you looking
Yeah,
good.
thank you so much. So, you know, we all have our own limitations and what we're capable of doing. So you just have to be honest with yourself and, you know, do what you can do. It's nice to have somebody to hold the camera, I'll tell you that. So, I had a really nice visit with the chaplain this morning. He came by. His name was Michael. He was a very, very nice man. And we had an excellent visit together. Praise God. We both. Hey,
No.
geez, leave him out of it.
Well, baby, because it's a doctor. We don't know if they want to be on video.
Before you turned it on.
Well, baby, I stopped because I don't know if I can continue right now in video, but I don't want to just film physicians
Okay.
without their permission.
Well, I know. But, all right, so we had a meeting with Dr.
Wait.
Dr. Way, and that's why we kind of stopped the video for a little while. We weren't sure if he wanted to be videoed or not. We're just trying again to be respectful. But just doing my lap, and you know, I was conversing with him, and you know, he's very pleased with how the procedure went. Everything went really well. So just going to keep building off of that, you know, and keep progressing from there. So my lovely wife and I, I'm trying to think if there's anything that I missed. You know, I posted a short video, and I'm sorry I'm not able to talk louder. You may have to turn your volume up when you're watching this video, but I posted a short for them removing that drain tube.
The room?
And is my room?
Yeah, do you want to go
Okay.
back there?
So I'm back to my room now. We're going to do one more lap, but that'll be all for this little segment. Of course, you'll just see the fade in.
So the first thing we're gonna do.
Okay, we're doing a J2, but now this is what we're doing. So I'll just show you how that goes. And with the J2 meds, you always want to flush first and after.
Hey, Dad.
Whenever you administer something in the J2.
Okay, I can watch after your people, but I'm doing some J2 meds right now.
So that's what we're doing now. So just bear with
You
us.
go ahead. They can call me.
All right, now
You
gonna
can
hit-
forward your stuff to me. It's
hit
fine.
the
Always
video.
gonna do two things with the tube. Always gonna flush before
And after.
and after. If we had more than one med, we would flush in between the meds too. We'd do one med at a time and flush in between, a smaller amount.
Do I need to buy those syringes myself?
You will have a whole huge supply of these to go home with once your supplies are delivered next week. You'll have these. We'll give you extra. You'll have food. You'll have your own pole, your own pump, everything.
The feeding tubes from pump eventually, the feed, I know it's going to be something prescribed. We'll get that from the pharmacy or
Home health.
home? Oh, so we'll have nurses coming
Yes.
home?
Mm-hmm.
Really?
They'll come a couple times a week, or you'll have some sort of home health agency that'll supply your.
Okay,
Things.
but that's going to be included in the insurance, covered by insurance and everything?
Yeah, that's the way it goes for everyone else. I'm assuming.
Okay.
Yeah. I don't know much about insurance, but
Okay.
I do know
I
that.
hate insurance companies, I'm telling you. From the bottom of my heart, it's just...
I do know that before you leave, you'll have everything you need.
Okay.
And they usually deliver it here to the room so we can go through it with you and make sure that you have it, okay?
Okay. If there's some still air, then you can make...
We're good to go. After he's on his tube feeding, it'll be on your pole there, and we'll show you how to pause the tube feed, and then you're gonna flush, always before, always after, okay? All right, so the tube is nice and long, and again, this is something that you can do yourself too. Once, not now currently, but if when you get home, because He can reach up, hold his own tube, do a lot. We have people go home that don't have caregivers, so sometimes they have to learn to do it. It's a gravity tube, so you would know if what I mean by gravity is if I opened this and dropped it, whatever's in there is going to come back out. Okay, so I mean you can usually prevent that just by holding it straight up. Sometimes I just occlude it a little bit like that, just out of habit more than anything. Okay, so my first syringe is water. I'm gonna do about half. I feel a little bit of resistance, so I'm just gonna kind of look at the tube and just make sure it's adjusted properly. Make sure there's no. Sometimes when they get in, they get up against the chest wall. Sometimes you might have to move or raise your arm up, or just a variety of things. It's going in pretty well, but if we experience too much resistance, then we might have to get you to reposition just a little bit.
Okay, that's good to know. Now that's the med.
This is your oxycodone.
It's really thick, so that's another reason why you're having to
I thinned it out a little
rinse it
bit.
out.
I added just a little bit of water and that little bit,
You see how fast she's going in? It's,
Yeah, I'm looking at the speed and
okay.
everything.
He
You
doesn't.
don't have to go that fast, but it's not going to hurt you if you go that fast.
He doesn't know. He won't feel it. So.
Yeah.
And now
That's
I'm flushing it through. My tube's nice and clear. I'll go all the way to the end there, and then I'm just going to occlude it a little bit just to keep from having a mess. Now, that being said, this is all trial and error. You will spill it on him. You will shoot it on the ceiling probably more than once. The best thing to do is just laugh it off and redo it, okay? Because it's going to happen. It's happened to me all the time, numerous times over the years. If you get some resistance, you may turn your head. A dozen things can happen. It's not the end of the world.
Don't chew me out.
That's exactly right. Clean him up, start over again, okay? It's not that bad. Okay, so we're done. He's got his medications. We're going to go clean our syringes and
Okay.
that's it. And the next time I'm going to let you do it.
Okay.
Yeah.
All right.
Now, I'm not going to be here over the weekend.
Okay.
So whomever you have, if they don't volunteer or try to get you involved, tell them, I need to learn to do this.
Oh, yeah.
You need to show me. Because sometimes some of the younger nurses, they may not talk as much as I do or feel as comfortable talking like I do. And they may just think it's easier to do it themselves or that you don't want to do it or something. But
Right now I'm doing a breathing treatment. I just finished. Is all of it?
Yes, sir.
I don't have any more of that. And I'm gonna take a little nap. I've done 9 laps today so far. Been going since 6 a.m. so I'm ready to relax a little bit now. So I've been having a lot of trouble urinating after the catheter was removed. They bumped up my intake of fluids, and it's hard to explain, but it's like when I go to urinate, like I feel like I've lost a lot of sensation, so it makes it hard for me to go. And plus there's since they removed the catheter, it's been very painful for me to urinate, and so I believe if I can find a way to relax while I'm in that position, it'll be a lot easier for me to urinate. So I definitely do not want for them to have to put the catheter back in and start it all over again. So I'm trying to do everything I can to avoid that, to avoid the catheter going back in. So, but I peed like 220 milliliters since they removed the catheter this morning. So, not horrible, but I wish I could get just really one good urination. It was also hard for them to find a vein, so I guess I might be dehydrated. So hopefully with them bumping up the fluids, I'll be in a better position to have a more productive urine sample, so to speak. So I think we've talked about peeing enough, huh? So still in a lot of pain today, but since they have been able to give me meds through my J-tube, that's really helped a lot. But at the same time, I think that contributes to my dehydration. So I haven't really been able to sleep. Every time I start to fall asleep, my CO2 monitor starts beeping. So that's the problem so far. But, trying to make sure I'm not missing anything else. It's a little hard to talk and to keep my thoughts together because of the medications. So hopefully my wife and my kids will be back here soon, and because I really do miss their company. Yeah. That's my CO2 monitor. When I'm doing that exercise, my CO2 monitor goes off. It's alerting the amount of breaths I'm taking is elevated. Give myself a little break before I do the other exercise. I had downloaded all these videos onto my daughter's old iPad so I'd have movies to watch, but I really haven't been in a state of mind to watch a movie so far. I even tried to. So today has been about doing everything I can do to build up my lungs and keep them clear, managing pain at the same time. I've been off of oxygen ever since this morning, so all things considered, I'm doing good. Pain is better managed as long as I keep the meds flowing. Let's do the other exercise now. I'll go. I try to do that until I set that alarm off. As you can tell if you've been following the videos, I'm doing a lot better with the breathing. Even in just day 2, I'm doing better with the breathing and the talking while I'm breathing. So, just have to work on the urination. That's my biggest obstacle right now, is what I feel like. Getting over that hump. I wanted to make the last part of today's video. Again, this is day 2 of the actual surgery. So all in all, today was a good day. Kept improving the lung function through the day today, and the morphine really helped with that, being able to do the exercises of walking around without feeling like my insides are being ripped apart. So that's the sensation that I get when the pain meds wear off, is all these sites where they had entered my body to do the surgery, all these places. Whenever I would take a breath, it just feels like I'm being ripped. So the goal for tomorrow is to use the breakthrough morphine as little as possible, to really cut it down towards hopefully basically nothing that I'm adding on. So we want to get to where they're just giving me the pain meds through the J tube, and I'm not having to hit a button for breakthrough. So I have a little bit more convenience and more mobility once I get off the button. So trying to move in the right direction, keep moving in the right direction. So I haven't been able to sleep. I've slept like an hour here, 2 hours there. So that's another goal of mine tonight, is to really get a better length of sleep, better sleep. So I'm going to go ahead and make the last part of this video, so hopefully I can get it downloaded to YouTube so that people can, keep up with what's happening. And I hope that everybody's been able to follow along so far, that they've been able to understand what I'm saying in the videos. So, and for the most part, I think they've been able to tell just fine. So, talked to my mother earlier tonight, and a few different people communicated with. Everybody's very pleased, including myself, on the progress that I've made. So tonight, really just want to get some rest. But of course, I'll be posting another video. Tomorrow will be day 3. And for the rest of the day today, I'm just going to relax and try to get this video posted and get some good sleep, and get right back at it tomorrow, hopefully with using less of the pain medication. So I hope that wherever you are, whatever you're doing, that you're having a good day, and enjoy the day you have.